Do you know that if you catch most cancers, including prostate cancer, in their early stages, you have a higher chance of healing? And the best way to do so is to recognize the warning signs. Prostate cancer is one of the most common cancers among men, yet it often shows no symptoms in its early stages. That's why awareness and early detection are so critical. By the time symptoms appear, the cancer may have already progressed. But here's the good news. If caught early, prostate cancer is highly treatable. In fact, the 5-year survival rate for localized prostate cancer is nearly 100%. That's why it's so important to recognize the warning signs and take action. In this video, we'll explore the early signs and symptoms of prostate cancer, discuss management options, and emphasize the importance of regular screenings. Whether you're in your 40s, 50s, or beyond, this information could save your life. Let's start with the early signs and symptoms of prostate cancer. While early-stage prostate cancer often has no symptoms, there are certain warning signs you should never ignore. These symptoms can be subtle, but they're your body's way of telling you something might be wrong. Paying attention to these signs and seeking medical advice early can make all the difference. Let's break them down into 3 categories: urinary symptoms, sexual symptoms, and general symptoms. We'll also discuss what you can do if you experience any of these signs. Urinary prostate cancer, signs and symptoms. 1. Difficulty starting urination. First, let's talk about urinary symptoms. The prostate gland surrounds the urethra, the tube that carries urine out of the body. When something's wrong with the prostate, it often affects urination. One of the most common signs is difficulty starting urination. You might notice hesitation or a delay when trying to initiate urine flow. This happens because an enlarged or cancerous prostate can block the urethra, making it harder for urine to pass. If you're experiencing this, don't ignore it. Consult a healthcare provider for evaluation. They may recommend a prostate-specific antigen, PSA, blood test, which measures the level of PSA in your blood. Elevated PSA levels can indicate prostate issues, including cancer. Your doctor may also perform a digital rectal exam, DRE, to physically assess the size and texture of your prostate. These tests are quick, simple, and can provide valuable information about your prostate health. 2. Weak or interrupted urine stream. Another urinary symptom to watch for is a weak or interrupted urine stream. You might notice that your urine flow isn't as strong as it used to be, or it starts and stops unexpectedly. This is another sign that your prostate could be affecting your urinary system. A weak stream can be caused by an obstruction in the urethra, which may be due to an enlarged prostate or a tumor. If this happens, seek medical advice. Your doctor might suggest imaging studies like a multiparametric MRI to evaluate your prostate for abnormalities. This advanced imaging technique provides detailed pictures of the prostate and can help identify suspicious areas. Early detection is key to effective treatment, so don't delay if you notice changes in your urine flow. 3. Frequent urination. Next, let's talk about frequent urination, especially at night. If you find yourself waking up multiple times to urinate, it could be a sign of prostate issues. Prostate cancer can lead to frequent urination, particularly at night, a condition known as nocturia. This occurs because the prostate gland encircles the urethra, the tube responsible for transporting urine from the bladder out of the body. As prostate cancer progresses, the tumor can enlarge, exerting pressure on the urethra and causing a partial obstruction. This obstruction disrupts normal urine flow, leading to various urinary symptoms. Mechanism behind nocturia in prostate cancer: urethral compression. The growing tumor narrows the urethral passage, making it difficult for urine to flow freely. This results in incomplete bladder emptying during urination. Bladder overactivity. The obstruction can cause the bladder muscles to work harder to expel urine, leading to increased bladder muscle activity. This heightened activity can cause a more frequent urge to urinate, including during nighttime. To manage this, try maintaining a bladder diary to track your urination patterns. Write down how often you urinate, the volume of urine, and any associated symptoms. This can help your doctor identify patterns and potential causes. Additionally, limit fluid intake in the evening. especially caffeine and alcohol, which can irritate the bladder. If symptoms persist, consult a healthcare provider to rule out prostate issues. They may recommend further tests or treatments to address the underlying cause. 4. Burning sensation during urination. Another concerning prostate cancer sign is pain or a burning sensation during urination. In some cases, this discomfort can be a symptom of an infection, inflammation. Unfortunately, sometimes it is prostate cancer. The tumor can cause a burning sensation during urination, a symptom known as dysuria. This occurs when the cancerous growth within the prostate gland exerts pressure on the urethra, the tube responsible for carrying urine from the bladder out of the body. This pressure can lead to irritation and inflammation of the urethral lining, resulting in pain or a burning feeling during urination. If you experience this, don't wait. Seek prompt medical evaluation. Your doctor may perform urine tests to check for infections or other abnormalities. They might also recommend a urine culture to identify bacteria or a cystoscopy to examine the bladder and urethra. If symptoms persist, further diagnostic procedures such as a prostate biopsy may be necessary. Remember, early intervention can prevent complications and improve outcomes. Before we continue, I want to ask for your support. If you're finding this information helpful, please hit that subscribe button and join our community. My goal is to reach 100,000 subscribers this year, and I can't do it without you. Your support helps me create more life-saving content like this. Now let's get back to the warning signs. 5. Blood in urine or semen. Another red flag is blood in urine or semen. This is a serious prostate cancer sign. It can be alarming, and rightfully so. Prostate cancer can cause the presence of blood in urine, hematuria, or semen, hematospermia, due to several mechanisms: tumor invasion and vascular disruption. As prostate cancer progresses, malignant cells can infiltrate surrounding tissues, including the urethra and bladder. This invasion can damage blood vessels, leading to bleeding that manifests as blood in the urine or semen, inflammation, and infection. The cancerous process may induce inflammation within the prostate and adjacent structures. This inflammation can compromise the integrity of blood vessels, resulting in bleeding. Additionally, secondary infections can occur, further increasing the risk of hematuria and hematospermia. Obstruction and increased pressure. Tumor growth can obstruct the normal flow of urine or seminal fluid, leading to increased pressure within the urinary and reproductive tracts. This pressure can cause small blood vessels to rupture, resulting in hematuria or hematospermia. It's important to note that while blood in urine or semen can be associated with prostate cancer, these symptoms are more commonly linked to benign conditions such as infections, inflammations, or non-cancerous prostate enlargement. However, if you notice blood, consult a healthcare provider right away. They may perform tests such as a urinalysis, PSA test, or imaging studies to identify the underlying cause. In some cases, a referral to a urologist for specialized evaluation may be necessary. Don't delay. This could be a critical warning sign. Prostate cancer and sexual symptoms. In addition to urinary problems, early prostate cancer signs often include sexual symptoms, primarily erectile dysfunction. No man wishes to experience this challenge, but unfortunately it can occur. As the cancer progresses, it may cause sexual symptoms, including erectile dysfunction. This occurs because the prostate gland surrounds the urethra, and as cancer develops, it can press against the urethra, leading to urinary issues. 6. Erectile dysfunction. Now, let's discuss sexual symptoms. Prostate issues can also affect sexual health. One common symptom is erectile dysfunction, difficulty achieving or maintaining an erection. No man wishes to experience this challenge, but unfortunately it can occur. As the cancer progresses, it may cause sexual symptoms, including erectile dysfunction. This occurs because the prostate gland surrounds the urethra, and as cancer develops, it can press against the urethra, leading to urinary issues. But in most cases, erectile dysfunction, ED in prostate cancer patients is primarily a result of treatments rather than the cancer itself. Prostate cancer treatment, such as surgery, radiation therapy, or hormone therapy, can also contribute to erectile dysfunction. The treatment can decrease your body's ability to create testosterone, which in return impacts your libido and ability to achieve and maintain an erection. While this can have many causes, including stress, diabetes, or cardiovascular disease, it is important to discuss it with your healthcare provider. They can help you explore treatment options, including medications like PDE5 inhibitors or hormone therapy. Counseling can also provide psychological support if needed. Another sexual symptom to watch for is painful ejaculation. If you experience pain during or after ejaculation, it could be related to your prostate. Consult a healthcare provider to investigate potential causes and appropriate treatments. Don't suffer in silence. Help is available. 7. Back pain. You may also experience back pain if you have prostate cancer. Persistent pain in your back, hips, or pelvis could be a sign that prostate cancer has spread to the bones. This is known as metastatic prostate cancer and requires immediate attention. If you have ongoing discomfort in these areas without a clear cause, seek medical evaluation. Imaging studies such as a bone scan or CT scan can help assess for possible metastasis. Managing back pain associated with prostate cancer can be approached through various non-pharmacological methods that complement medical treatments. Most common of them include A. Physical therapies, massage therapy. Regular massages can alleviate muscle tension and improve circulation, potentially reducing back pain. Heat and cold therapy. Applying heat can relax tense muscles, while cold packs can reduce inflammation and numb deep pain. B. Mind-body techniques. Progressive muscle relaxation, PMR. This technique involves tensing and relaxing different muscle groups, which can help reduce pain perception and improve overall well-being. Mindfulness-based pain management, MBPM. Incorporating mindfulness practices can help individuals manage chronic pain by altering their perception and response to discomfort. C. Acupuncture and acupressure. These traditional Chinese medicine practices involve stimulating specific points on the body to relieve pain and promote healing. Some individuals find relief from back pain through these methods. Supportive therapies, emotional support and counseling are highly helpful. Engaging in therapy or support groups can help address the emotional aspects of chronic pain, providing coping strategies and reducing stress-related pain exacerbation. E. Taking painkillers. Managing back pain associated with prostate cancer often involves a combination of pharmacological and non-pharmacological approaches. Some of the medications commonly prescribed to alleviate pain and improve quality of life include non-steroidal anti-inflammatory drugs, NSAIDs, acetaminophen, Tylenol, for instance, topical analgesics, opioids, antidepressants, and anticonvulsants, and in some cases, bone-targeted therapies. 8. Unexplained weight loss. Another general symptom is unexplained weight loss. Prostate cancer can lead to cachexia, a syndrome characterized by significant weight loss, muscle wasting, and fatigue. This condition occurs due to the body's altered metabolism and the cancer's increased energy demands. Another reason of the weight loss is cancer-induced metabolic changes. Cancer cells often demand more energy than healthy cells, leading the body to burn more calories at rest. Additionally, cancer cells release substances that affect how the body uses calories from food, contributing to weight loss. If you're experiencing any of the signs or symptoms above and losing weight without changes in diet or activity, report this to your healthcare provider immediately. A comprehensive evaluation, including blood tests and imaging, can help identify potential causes. Remember, these symptoms don't always mean cancer, but they should never be ignored. The importance of early detection cannot be overstated. Early-stage prostate cancer is highly treatable, and regular screenings like PSA tests and DREs are vital, especially for individuals at higher risk. Men over 50 African American men and those with a family history of prostate cancer should discuss screening with their healthcare provider. Awareness of these early signs and proactive management can significantly impact your prognosis. Don't wait for symptoms to worsen. Take charge of your health today. In conclusion, being vigilant about prostate health is one of the best things you can do for yourself. If you experience any of these warning signs, don't ignore them. Consult a healthcare provider and take proactive steps to manage your prostate health. Early detection saves lives, and your health is worth it. If you found this video helpful, please give it a thumbs up, share it with someone who needs to hear this, and don't forget to subscribe. Together, let's reach 100,000 subscribers and spread awareness about prostate health. Take care of yourself, and remember, your health is in your hands.